What if one simple screening test could detect cancer before you ever had symptoms? Every year, thousands of women are diagnosed with cervical cancer, yet many of those cases could have been prevented or found early through routine screening. In today's video, we're going to discuss what cervical cancer is, who is at risk, the warning signs, screening tests, treatment options, survival rates, and what life may look like after diagnosis. This information could save your life or the life of someone you love. What is cervical cancer? Cervical cancer is a type of cancer that begins in the cervix, which is the lower part of the uterus connecting to the vagina. The overwhelming majority of cervical cancers are caused by persistent infection with certain high-risk types of the human papillomavirus, commonly known as HPV. HPV is one of the most common sexually transmitted infections in the world. Most HPV infections go away on their own, but some high-risk strains can remain in the body for years and eventually lead to cancer. The good news is that cervical cancer is one of the most preventable forms of cancer because we have effective screening tests and vaccines that help reduce the risk. Can cervical cancer be found early? Absolutely. This is one of the few cancers that can often be detected before it becomes cancer. Routine Pap tests and HPV testing can identify abnormal cells years before they develop into cancer. Doctors can then remove or treat those abnormal cells before they become life-threatening. Early detection truly saves lives. Screening tests. The most common screening methods include Pap smear, Pap test, looks for abnormal or precancerous cervical cells. HPV test, checks for high-risk HPV types known to cause cervical cancer. Many healthcare providers now perform both tests together, depending on your age and medical history. Talk with your healthcare provider about when you should begin screening and how often you should be tested based on your personal risk factors. Signs and symptoms. One of the most dangerous things about cervical cancer is that early stages often cause no symptoms at all. As the disease progresses, symptoms may include abnormal vaginal bleeding between periods, bleeding after sexual intercourse, bleeding after menopause, unusual vaginal discharge that may be watery, bloody, or foul-smelling, pelvic pain, pain during intercourse. As cancer advances, additional symptoms may include lower back pain, swelling in the legs, difficulty urinating, blood in the urine, unexplained weight loss, fatigue. If you experience any of these symptoms, don't ignore them. They don't always mean cancer, but they should be evaluated by a healthcare professional. Risk factors. Several things increase the risk of cervical cancer, including persistent HPV infection, smoking, a weakened immune system, HIV infection, having multiple sexual partners, early sexual activity, long-term use of certain hormonal contraceptives in some individuals, not receiving regular cervical cancer screening. It's important to remember that having a risk factor does not mean you will develop cervical cancer. It simply increases the likelihood. Stages of cervical cancer. Doctors classify cervical cancer into stages. Stage 0. Precancerous cells are found only on the surface of the cervix. Stage 1. Cancer is confined to the cervix. Stage 2. Cancer has spread beyond the cervix, but not to the pelvic wall. Stage 3. Cancer has spread into the lower vagina, pelvic wall, or may block the kidneys. Stage 4. Cancer has spread to nearby organs such as the bladder or rectum, or to distant organs like the lungs, liver, or bones. Generally, the earlier the stage at diagnosis, the better the chance for successful treatment. Even more advanced stages may still respond well to combinations of surgery, radiation therapy, chemotherapy, targeted therapy, and immunotherapy. Treatment options. Treatment depends on the stage of cancer, overall health, age, and whether future pregnancy is desired. Treatment may include surgery to remove abnormal tissue or the cervix, hysterectomy, which removes the uterus and cervix, radiation therapy, chemotherapy, targeted therapy, immunotherapy. Many patients receive more than one treatment. Your oncology team develops an individualized treatment plan based on your specific diagnosis. Side effects of treatment. Side effects vary depending on the medications and therapies used. Possible side effects include chemotherapy, hair loss, fatigue, nausea, vomiting, diarrhea, loss of appetite, increased infection risk, radiation, skin irritation, fatigue, diarrhea, bladder irritation, vaginal dryness or narrowing, immunotherapy, skin rash, joint pain, fatigue, immune-related inflammation affecting different organs. Fortunately, doctors have many medications and supportive treatments available to help manage these side effects. Diet during treatment. There is no single cervical cancer diet, but good nutrition plays an important role in recovery. Many healthcare teams recommend plenty of fruits and vegetables, lean proteins, whole grains, staying well hydrated, small frequent meals if nausea develops. Some people may temporarily need to avoid spicy, greasy, or highly processed foods if they worsen digestive symptoms. Always ask your oncology team before taking vitamins, supplements, or herbal products, since some may interfere with treatment. How will treatment affect daily life? Many women continue portions of their normal routine during treatment, while others need additional rest. You may experience increased fatigue, more frequent medical appointments, temporary time away from work, emotional stress, changes in sexual health, fertility concerns for some younger women. This is why having support from family, friends, counselors, faith communities, or cancer support groups can make a tremendous difference. Survival rates. Survival depends largely on how early the cancer is found. When cervical cancer is diagnosed before it has spread outside the cervix, the 5-year survival rate is generally very high. As cancer spreads to nearby tissues or distant organs, survival rates decrease, highlighting why regular screening and early diagnosis are so important. Remember, survival statistics describe groups of patients. They cannot predict what will happen to any one individual. New treatments continue to improve outcomes every year. Unfortunately, not all women have equal outcomes. Some communities experience higher death rates from cervical cancer because of limited access to healthcare, lower screening rates, delayed diagnosis, financial barriers, lack of health insurance, differences in follow-up care. Expanding access to screening, HPV vaccination, and timely treatment can help reduce these disparities and save lives. Prevention. Here are some of the best ways to lower your risk. Get regular PAP and HPV screening. Consider HPV vaccination if appropriate for your age and health history. Don't smoke. Practice safer sex. Keep follow-up appointments if an abnormal test is found. Remember, finding abnormal cells early often prevents cervical cancer from ever developing. Cervical cancer is one of the most preventable cancers we know about. The combination of HPV vaccination, regular screening, early diagnosis, and advances in treatment has saved countless lives. If you or someone you love has been putting off a PAP test or HPV screening, let today be the reminder to schedule that appointment. Early detection doesn't just improve treatment, it can prevent cancer altogether. This video is for educational and informational purposes only and should not be considered medical advice, diagnosis, or treatment. Always consult your physician, gynecologist, oncologist, or another qualified healthcare professional regarding your individual health concerns, screening schedule, symptoms, or treatment options. Never ignore professional medical advice or delay seeking care because of something you watched online. If you found this video helpful, please give it a thumbs up, subscribe to the channel, follow for more trusted health information, and share this video with your family and friends. Your share could encourage someone to get screened early and possibly save a life. Thank you for watching, and I'll see you in the next video.